All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, the discussion today is about magnesium. There are so many studies that I want to go over. Hence, I will not dig very deep in the magnesium's own mechanism of action. Instead, just sufficient mechanism of action and sufficient review of the studies so that we can understand what does magnesium contribute and how much does it contribute during acute COVID or long COVID, and in general during MECFS and other illnesses as well. So let's start our discussion. So this is drbeen.com. This actually, if you see here on our staging servers, these are the course pages. So these course pages have almost become live. They are being tested right now. So within another few days or weeks, we thought that by January middle will be done, but we have slipped. So we'll go to the courses, and as you can tell, when we will go to the courses, then specific courses will have their own fee. However, if you wanted to take advantage of just getting access to drbeen.com for lifetime, then this is the last few days, weeks to get this at 67. This would never happen again. So I hope you like the design of this. Some thumbnails are being done, and the system is being tested. So I'm pretty excited about this. Okay, so with this, and the link for this 67 is in the description of this video. All right, so I'm going to start with let me quickly show you the studies. This is one study: higher intake of dietary magnesium is inversely associated with COVID-19 severity and symptoms in hospitalized patients, a cross-sectional study. Then this is another study. One second. This is the relevance of magnesium homeostasis in COVID. Then these are some other supporting studies. Can maintaining optimal magnesium balance reduce the disease severity for COVID-19 patients? Then here, impact of magnesium supplementation in muscle damage of professional cyclists competing in stage race. I specifically wanted to discuss this study. It doesn't have anything to do with COVID apparently, but in some patients of long COVID, neurological symptoms and muscle fatigues and pains are common. And this is an example of muscle damage in the professional cyclists after they have done rigorous cycling. And they gave one part of them, one cohort of them received magnesium, others didn't. And those who received magnesium had lesser muscle damage proteins in their circulation. So it is a muscle protective. And there is also one more thing, if I can just put that in front of you. Magnesium helps protect against overexcitation of neuronal tissue, which that overexcitation can actually cause neuronal death. So magnesium is protective there as well. So imagine now magnesium is protective for brain tissue plus protective for muscle tissue. Combined this neurological symptoms and muscle symptoms, especially in long COVID, magnesium is very, very interesting. Then the role of magnesium in neurological disorders, neural mechanisms. Here, magnesium relaxes arterial smooth muscles by decreasing intracellular calcium without changing intracellular magnesium. And then the role of proportions of furins. So some other studies here. So with this studies in front of us, let's look at my presentation today. So the role of magnesium, the first thing, of course, all the providers, doctors, nurses, NPs, PAs, PhDs, they know that this particular topic, and I'm going to write it down here or say it as well. Magnesium sulfate must not be abbreviated MS in any of the prescriptions, as this may result in administration of morphine sulfate, including the therapeutic purpose of the patient's diagnosis can prevent this error. So if you put the diagnosis and say, I'm giving magnesium sulfate, maybe spell it out completely, or MAGSO4, but don't put MS. This, and I think you already know this. Now, financial disclosures, because this lecture will become a CME lecture as well, I have no disclosures. No company asked me to produce this, and I do not have any shares in something that would do magnesium or that will benefit from this. Okay, so quick summary of magnesium's role. And remember, magnesium is a nutrient that is involved in more than 600 enzymatic actions in our body. So I cannot list them all, but some important actions in context of COVID and long COVID and MECFS are the following. Magnesium is anti-inflammatory, especially it modulates the innate arm. And remember, innate arm is the first arm that encounters the infections or inflammation. So activating the T cells, activating the innate arm cells is very important, and magnesium modulates their correct activation. And not only that, do you know, even if you have correct levels of vitamin D in your body, if you do not have correct levels of magnesium, that vitamin D cannot become activated. So magnesium actually helps activate vitamin D, even if the levels are normal. But if magnesium levels are not correct, imagine you also have vitamin D deficiency. And so many people have correct vitamin D levels, but incorrect magnesium levels. And so they would, to their body, it would appear that they have lack of vitamin D as well. This is also why magnesium is very important. Magnesium has been used in management of asthma, although studies have always had mixed bag. Some studies show efficacy, some do not, but it is used. And what magnesium does is that it relaxes the bronchial smooth muscles. It actually relaxes the vascular smooth muscles as well. And you can actually think about it in long COVID. Vascular smooth muscle relaxation, more blood flow is actually very important. This is something that methylene blue or nitric oxide production or near infrared light would also do. So having magnesium will be another partner in these with these substances or interventions. Then it maintains muscle integrity. Magnesium is muscle protector, and the reason that it can protect the muscle is that magnesium actually can block entry of calcium inside the nerve and muscle. And I'll show you the receptor which work with it. So when it reduces the amount of calcium entry, it, by that mechanism, reduces the overexcitation of muscle or nerve. And that is how it protects them. This is equal to it protects an engine from overheating. So it's not really the heat, but overactivity of brain tissue or muscle tissue, it protects against that. Then important for regulation of muscle contraction, including heart. So imagine this, in long COVID, many patients have neurological issues, they have pains, they have muscle aches, they have fatigue, and even cardiovascular issues. Magnesium's correct level is very important to bring these systems in a protective state and in a correct functional state. And all of these references are down here. I just showed you those as well. And because this is CME, once again, I have the numbers here with the studies from where these messages are. Now, before we go in the studies, I want to give you upfront what is really the outcome of this all, the recommended daily amount of magnesium intake. Correct? That at the end of the day, that is what we need to know. So 14 to 18 years of age, females 360 milligram per day, males 410 milligram. 19 to 30 years, 310 milligram females, 400 milligram males. 31 plus, 320 milligram females, 420 milligram males. Then if you see One of the excerpt from a study is adequate magnesium level have been associated with lower mortality rates in COVID-19 patients and less severe symptoms. We'll look at that study in a minute. Natural sources of magnesium: avocado, spinach, almonds, pumpkin seeds, whole grains, black beans, wheat, and oatmeal, and magnesium supplementation. So, whatever works for you. If it is foods, then here is a list of those. Or if you can have the supplementation, then there is a list of that as well. Jim is saying that pineapple is a good source of magnesium. And this is very important message that Embol has. Taking magnesium separate from other competing supplements should help. And so, yes, especially vitamin K2 and calcium. Okay, so back here, uh, another person, I believe this name is written in Korean language, but I cannot read it. So I can only say another person, banana and seaweed. Okay. So this is a very good question. Jennifer says, what level do we want for magnesium? So Jennifer, the daily RDA that I'm showing here is fine. Hypermagnesemia has shown, hypermagnesemia, that is more magnesium in the blood or serum, has also shown to be detrimental for acute COVID patients. So don't overload a patient. So the best way is for your doctor to look at the magnesium levels and then bring them towards normal if they are down. However, even if they are normal, this is the daily recommended RDA. So continuing. So mechanism of action, very briefly, it has so many 600 plus functions or involvement in various functions. So you can imagine that I can continue talking about mechanisms for 2 years and not finish. And I can do one lecture every day. And even then in 2 years, I will not finish. So just generally, calcium blocker in glutamatergic receptors. So imagine that this one is a neuron, and here where my mouse is moving, that is the neurons inside, and where my mouse is now, that is the outside. And I have taken this diagram from this study, the role of magnesium in neurological disorders, and thanks to them for this. Now, here, if you see, magnesium is sitting in the middle of the glutamatergic receptor. What that means is it's a receptor that responds to glutamate as a neurotransmitter. And if you see here, the glutamate comes and attaches to the outside of this receptor that opens up the receptor and allows calcium and sodium to go in and potassium to go out. So these are very common channels where we have such counter transportation of various ions, especially in the muscle and blood vessels and in neuronal tissue. This is glutamatergic receptors in neuronal tissues. So what happens is once the glutamate comes and attaches here, then the calcium goes in. And when the calcium will go in, the nervous system tissue neuron will become excited. However, if you see here, magnesium blocks this. And this blockade by magnesium in normal levels is very important. It keeps in check how many receptors will open, how many channels will open, how many floodgates will open, how much calcium should pour into the neuron. So even if the glutamate is present, even if the receptor wants to be open, magnesium's level will decide how much calcium goes in and how much excitation occurs. Now, if somebody has lower levels of magnesium, then they do not have sufficient blockers of this channel. And so channel would overheat. It will work more than it should, and it will bring more calcium inside the neuron. That would cause overexcitation of the neuron, which will cause the neuron to commit suicide, to do apoptosis. This is an engine. If you imagine the neuron is a car engine, when you rev it too much, it would just burst up and die. So who protects it? Magnesium. So this is called excitatotoxicity. or excitotoxicity. So magnesium protects the neuron, and I would say also the muscles, from excitation toxicity. This is very important. Okay, so let's look at these studies a little bit. So here is the first study. Higher intake of dietary magnesium is inversely associated. So here they're saying, let me increase the size. Magnesium is an anti-inflammatory mineral that plays a role in the innate immune system, and the relaxation of bronchial smooth muscle warrants additional attention in COVID-19. So if you see here, they did this study in a cross-sectional study was done, enrolling 250 COVID-19 patients aged 18 to 65 years. A validated 168 item online food frequency questionnaire was given. So they had these 250 patients. They asked them, what kind of food are you taking, so that they can figure out what magnesium levels they may have or what magnesium intake they may have. This is a beautiful study. So what they did was they separated, let me go down for a second here. What they did was they separated the magnesium levels. Let me see which one. General characteristics. So let me open this for a second. They separated the folks into various tertiles. Tertiles are just like quartiles. Tertiles are, they divided magnesium levels into three groups. So lower magnesium level, middle magnesium levels, and high magnesium level. And guess what they found? People with the higher magnesium levels in their blood had lower, not only severity of COVID, but even lower symptom set of the COVID. So let me actually show you those. So this is the one table. This is another table where they're talking about magnesium intake. So if you see here, these are various cohorts, and in there, this is the level of their nutrients, energy and carbohydrates and fats and proteins and blah. And down here, you would see magnesium milligram per day, 278, 328, 379. 278 milligram per day is definitely on the lower side. 379 per day, milligram per day, is definitely on the correct side. And so those patients who were taking 379 milligram per day, they were actually having less severe COVID, and they had less symptoms. Their hospital stay was less as well. And this is all significant data. So p values are all significant. It's not a fluke. So then if I go further and talk about this table 3. So tertiles of magnesium intake. So once again, if you see here, what they found was very interesting. Those that had lower magnesium level, they had more inflammation. That means their innate arm was incorrectly behaving. That means they were developing cytokine storms. So if you see here, CRP, C-reactive protein, which is an acute phase protein produced by liver in response to inflammatory messages, markers, and erythrocyte sedimentation rate, or ESR. The third tertile, T3 here, had the best numbers. Look at it. T1, CRP 29.5 milligram per liter. T3, CRP 11.8 milligram per liter, and the P value is significant. Can you imagine this? These are such important things. So just magnesium can be gotten from food or the supplements. So this is a beautiful table. Check this out. Various tertiles of magnesium, and we saw the levels from 270 to 380 milligram per day. The tertile 1, they used that as a reference. So the severity that occurred in the lower magnesium takers, if you take that as the reference, then tertile 3, the ones who had the magnesium in their correct dosage, normal RDA dosage, some 380 milligram per day, 0.24 was the odds ratio, meaning really lower levels, and the p-value is significant. So this is a very interesting study. I would request you to read this study a little more thoroughly. Because I wanted to encompass a lot of data today, I'm not going into one study. However, please read this as well. We are aware that combining vitamin D, vitamin B12, and magnesium was associated with a significant reduction in the need for oxygen support or intensive care in elderly COVID 19 patients. What an important thing. And what a simple thing. Magnesium, vitamin D, B12, zinc, folic acid, right? Simple things. As nutritionally expected, we observed that the highest tertiles for magnesium intake were associated with higher intake of fruits, vegetables, legumes, and nuts, which are recognized sources of magnesium and display an important role against low grade inflammation thanks to the food matrix. I almost think that our COVID management should have been place the patient under sunlight and correct their supplements. Again, please don't take me this message as a management approach. I just am thinking and offering my opinion, not a medical advice. So, cytokine storm, check this out. Cytokine storm, which is COVID is notorious for that, right? Cytokine storm drains ATP. ATP is the energy with which things are working. So when the patient is in cytokine storm, every cell is working at a heightened level. Of course, that is going to take all the energy out. This is like your car's battery. If you do not run the engine but just put lots of lights on, the battery is going to drain. So cytokine storm drains ATP in COVID-19, whose regeneration requires magnesium along with phosphate. This is why magnesium phosphate is very interesting. So cytokine storm occurs. Imagine me. I never like to give example of somebody else. I wish everyone stays healthy. Imagine me. I got cytokine storm. Now I'm burning through my energy, ATP. I need more energy for my immune system cells to work correctly. I need more energy for my lung cells to work correctly, for my brain to work correctly, for my muscles to work correctly, for my blood cells to work correctly. And guess what? To have the correct levels of ATP, I need to have the correct level of magnesium. So I can use the stores present, but I cannot create more stores of energy if my magnesium levels are not correct. And with magnesium, we need phosphate as well, because this calcium, magnesium, phosphate, they are kind of a trio. And we know that for calcium and vitamin D, then we also need K2. So vitamin D, calcium, magnesium, phosphate, and K2 are very, very important because they all kind of interplay with each other. Therefore, adequate magnesium body storage is crucial to avoid an aggressive magnesium deficiency in severe COVID-19. Furthermore, magnesium plays an important role in the relaxation of bronchial smooth muscle, and thus its deficiency might result in respiratory dysfunction. Then, the innate arm, immune arm, is the first line of defense. And guess what? T cell activation and macrophage activation and vitamin D activation, which further helps modulate T cells' balance behavior. And I've done those discussions 2 years ago. They need magnesium. So finally, magnesium regulates the immune system in a variety of ways by orchestrating the activity of immune cells, such as neutrophils, macrophages, activating T cells via MAG-T1, and regulating vitamin D activity, hence improving the first line of defense in response to pathogen invasion and acting against viral infection like COVID-19. And this study continues. I would request you to once again read it. It's a beautiful study. So that's one. Then going to the next study, the relevance of magnesium homeostasis in COVID-19. So here what they are saying is the following. They said, despite many methodological limitations, so they did a cross-section study as well. Existing data seem to corroborate an association between deranged magnesium homeostasis and COVID-19 and call for further and better studies. We propose to reconsider the relevance of magnesium frequently overlooked in clinical practice. Therefore, magnesium should be monitored, and in case of imbalanced magnesium homeostasis, an appropriate nutritional regimen or supplementation might contribute to protect against SARS-CoV-2 infection, reduce severity of COVID-19 symptoms, and facilitate the recovery after the acute phase. Very important. Then I'm going to leave my presentation and just go from these. Can maintaining optimal magnesium balance reduce the disease severity of COVID-19 patients? So again, in this study as well, what they're talking about is magnesium homeostasis includes intestine, bone, and kidney, because intestine are there to absorb, then kidney is there to secrete or excrete, and then bone is there for storage or release. With phosphate, with calcium, with vitamin D and K2. The recommended daily amount of magnesium intake, I have shown you this one. One such system, so magnesium is a cofactor for over 600 enzymes. One such system is the inflammatory system. Magnesium has been shown to have potent anti-inflammatory effect. Low magnesium levels in rats have been associated with augmented inflammation, and higher magnesium levels have been associated with a reduction of C-reactive protein, which I showed you in COVID patients. So you don't have to go for the rat study. There is now COVID study that shows it. Beautiful, isn't it? Very important as well. And then they talk about asthma and other mechanisms here as well. Then another essential role that magnesium plays in the body is its effect on activating vitamin D. And I just discussed it. Vitamin D will not activate even if it is present. The enzymes are required to convert the inactive form of vitamin D to the active form of vitamin D, where magnesium acts as a cofactor. Cofactor is, let's say I am an enzyme now. I am everything today. Imagine if I'm an enzyme that is going to work with vitamin D to activate it. I need a cofactor, which is magnesium. I need a lot of cofactors. One of them is magnesium. If magnesium is not there, then even in the presence of correct levels of vitamin D, I as an enzyme cannot convert the vitamin D to active form because I don't have magnesium. So the health benefits of vitamin D will not be achieved even with adequate vitamin D levels if magnesium is deficient, thus emphasizing the essential role of maintaining optimal magnesium levels to attain desirable benefits of vitamin D. This is the statement that should be written in front of in every clinic instead of any cartoons or other things. So this is also a very thorough, very interesting study. So my request is that please look this up as well. All links are in the description. Then impact of magnesium supplementation in muscle damage of professional cyclists. This is very interesting. And why did I bring it up? As I said before, for long COVID patients, one of the problem is the muscle fatigues and the pains. And I have discussed this in the past, that if we continue to try to move the muscles, but the muscle are not working correctly, then there can be damage that would occur and there can be pain as well. And this is a double whammy. If the neurological symptoms are also present, that means neurons are not functioning correctly, and then the muscles are not functioning correctly, that would further cause damage to the muscle, which would then cause inflammation, which would further aggravate the situation. And this is why it becomes, that would create a lot of lactic acid in that area, because COVID, and especially long COVID, is associated with lower blood supply because of the vascular activation or motor activity of the vascular smooth muscle, which causes vasoconstriction, which reduces the blood flow. So guess what will help? Infrared, near infrared, methylene blue, and any other thing, nitric oxide, for example, Cardio Miracle, and I have no relationship with them. There are many other L-arginine and nitric oxide and citrulline supplements that are available. And then here, if you see, magnesium is a cofactor. So in these cyclists, they had 18 cyclists total. 9 of them were given magnesium. 9 of them were not given magnesium. Then they were asked to do the rigorous cycling activity. And then they were taken blood serum with the agreed World Sports Organization agreed ways of taking blood before, middle, and after the activity. And they found naturally that as bicyclists were exercising, their muscles had broken some of the cells, and the broken proteins from the cells, or the muscle breakdown protein markers, were detectable in the serum. However, read this. So the group that was given magnesium, they were given 400 milligram per day of magnesium during the 3 weeks of competition. Blood samples were collected, and here is they found serum and erythrocyte magnesium levels decreased during the race. This is very important. It is not that if my magnesium level is good today, then it's going to be good in the evening and in the morning as well. It depends upon what am I doing and how much magnesium is being used in those actions. So serum and erythrocyte, that is red blood cell, magnesium levels decreased during the race. Circulating tissue markers, the muscles broke down and the tissue markers spilled out of the muscles, and they were circulating now, which they could pick up to see how much damage to the muscles is occurring. Circulating tissue markers increased at the end of the race in both groups. However, myoglobin is the protein of the muscle. Myoglobin increase was mitigated in the supplemented group compared with the controls. We conclude that magnesium supplementation seemed to exert a protective effect on muscle damage. Very important. This is correct. So You Betcha is saying yes, tamarind is a laxative. So magnesium is used in that format as well. Magnesium is also used for protection for the GIT2. So again, I'm going to keep myself towards the muscle, fatigue, neurological outcomes, and especially in the long COVID. So if, for example, methylene blue isn't working, or the near infrared is not working, or levoarginine is not working, or nitric oxide is not working, or citrulline is not working, although I doubt that they all together will not work, magnesium should be looked at. And when you look at magnesium, then you look at phosphate as well, then you look at calcium as well, then you look at vitamin D as well, and you look at K2 as well. And it may be that all other levels are fine and just magnesium and phosphate are low, and that is inhibiting or obstructing the other substances to be useful. The role of magnesium in neurological disorders. So if you see this one, magnesium is well known for its diverse actions within human body from a neurological standpoint. So this is the glutamatergic receptor. From a neurological standpoint, magnesium plays an essential role in nerve transmission and neuromuscular conduction. This is really very important. If the neuromuscular conduction, where the nerve brings a message for the muscle to move, if there is a problem at the neuromuscular junction, muscle would not work correctly and patient would feel pain. This is imagine if you have applied brakes on a car and you're also trying to push the car to work. So it's not exactly the correct example, but still, if the neuromuscular junction is not translating, or we say transducing, if it is not transducing the electrical signal correctly to mechanical signal, because the chemical part within the neuromuscular junction isn't working correctly, the receptors are not opening correctly, or they're not behaving correctly, or they're opening up too much, then the patient will feel fatigued and pain, because some fibers will work correctly and some will not. There'll be a lack of coherence of the muscles. And one of such reasons could be magnesium levels being incorrect, especially being low. So if you see in this study, I took this diagram from here, so thanks to the authors, and they have done a lot of work on how magnesium helps, for example, for migraine, for chronic pains. And I took this part because it is relevant to long COVID muscle pains. Fibromyalgia was initially considered a rheumatic disorder, but is now known to be a neurological condition with intense widespread pain and tenderness coupled with other unpleasant symptoms, such as severe fatigue, cognitive dysfunction, memory loss, headache, and sleep problems. And if you read this paragraph, erythrocytes, that is red blood cells, and intracellular muscle magnesium levels are decreased in fibromyalgia patients, while there have been evidence that plasma and serum levels remain in normal range. So within the red blood cells, magnesium level is less. Within the muscle, the magnesium level is less, even when it is circulating correctly in the body. However, other studies have shown significantly decreased magnesium serum levels in fibromyalgia patients compared to controls. Based on these findings, a recent study examined the effect of 300 milligram magnesium citrate and 10 milligram of amitriptyline alone and in combination in 60 women with fibromyalgia and 20 age and sex match controls over 8 weeks. Guess what they found? Both erythrocyte and serum magnesium levels were significantly lower in the fibromyalgia group. You could kind of equate this to long COVID with muscle fatigues and pain. Furthermore, the group receiving the combination of magnesium and amitriptyline reported significantly decreased pain across various pain and tenderness index scores. If you ask a long COVID patient that gets fatigues, if you just take away their pain and fatigue, they'll be so grateful. And so here, pain and fatigue is reduced with magnesium alone, results in an improvement in the number of tender points and intensity of fibromyalgia pain. Another study reported improved score on fibromyalgia impact questionnaire revised after 8 weeks of transdermal magnesium chloride solution use. And then if I continue, they talk about anxiety and depression. They talk about other diseases as well. Again, epilepsy. My focus today was to talk about long COVID, muscle fatigues, and neurological issues because people get really bothered and sometimes lose hope. Then there are more studies here, which are just supplementary studies. Look at this one. Magnesium relaxes arterial smooth muscle by decreasing intracellular calcium without changing intracellular magnesium. So magnesium is present outside and inside. And magnesium that is present inside is working as well within the cells with various enzymes. However, if the outside magnesium levels are not correct, then as you saw that receptor, a lot of calcium would just drop into the cell and cause excitation. Magnesium's correct presence outside allows the right amounts of calciums to enter the cell for neurons and muscles. That is very important. And here they're talking about not only that, but the heart muscles as well, which if I could take an extension from there, if something can help with the heart muscle, then that would help with the blood vessel muscles as well. So that means a long COVID patient that has a vasoconstrictive effect, blood vessels are not dilating correctly, or they are dilated correctly, but the blood is a little more viscous because of clotting, then they can take benefit from magnesium correct levels. And then finally, magnesium also seems to be helpful against the acute infection because it modulates the effect of TMPRSS2. What it does, it's actually so funny. What it does is it reduces the production of TMPRSS2. Remember, TMPRSS2 is necessary. Just trying to find the diagram. Somewhere over here. I'm going to go back here. So TMPRSS2 we know is important to cause the priming of the spike protein. And TMPRSS2 production is influenced by magnesium. So if the correct magnesium levels are present, then TMPRSS2 levels are reduced. If the magnesium levels are less, then TMPRSS2 levels are increased. Similarly, furin cleavage site and the furin cleaving enzymes. Higher magnesium, lower enzyme. Lower magnesium, higher enzyme. So this is another reason why during the acute infection, so now I've switched from long COVID back towards acute, why during the acute infection, if there is less magnesium level, then there is more activation of the spike proteins and more infection. So this is the discussion. I hope that you liked the discussion. Once again, for me, the takeaway, if you said, all right, we talked for 41 minutes, what's the takeaway? The takeaway is have your daily RDA of magnesium, calcium, vitamin D, phosphate, zinc, CoQ10 with your doctor's approval. This is the educational part, that this is necessary. Here we are looking at the studies, and discuss with your doctor and decide what is the best. And at the end, once again, we have the Dr. Bean last few days, weeks, that will have Dr. Bean at this very inexpensive price. The link is in the description. As soon as we launch the courses page, then the price will be different. So thank you very much. Stay safe, happy, healthy. If you are a long COVID patient, please do not lose hope. We are working for you and will continue to work for you. It just sounds so salesy to me to say that, but I think my 2.5 years of work now shows that I have been working in this direction. So please don't lose hope, and we'll continue. Thank you very much. Please like, subscribe, and share. If you would like to support this work, there are links in the description. You can buy me a coffee. You can become part of patrons. You can become part of this YouTube channel as well. And I would see you tomorrow. Bye-bye for now.